My presentation today is about cancer and alternative treatment options that cancer patients have. My name is Chantal Skinner. The purpose of this presentation is to inform people of another all-natural way that can be used to help when they are diagnosed with cancer. My audience is focused on those who are diagnosed with cancer, those people who know others that are diagnosed with cancer, and healthcare professionals. The overview of this presentation is going to focus on two things, the problem and the solution. During the section where I talk about the problem, we'll talk about cancer, the limited options that people are given, and the side effects. In the solutions portion of this presentation, we'll talk about Young Living essential oils, aromatherapy, and how the oils work. The problem that I want to focus on today is the fact that cancer rates are rising. According to the American Cancer Society, the risk of a man developing cancer in his lifetime is a little less than 1 in 2 men. When it comes to women developing cancer over her lifetime, it's a little more than 1 in 3 women. Cancer often comes back, so healthcare professionals must deal with cancer in 5-year increments. The 5-year survival rate for cancer is 66% among Caucasians and 58% among African Americans. When a person is diagnosed with cancer, the options that are normally offered are surgery, chemotherapy, radiation therapy, and the option to do nothing. Surgery can be done in some cases depending on what stage the patient is in their cancer and how far the cancer has spread throughout their body. If it's possible, they will perform surgery and try to remove the cancer from a person's body. Treatments such as chemotherapy and radiation therapy can be administered to try to kill the cancer in someone's body. The third option is the option to do nothing, where the patient will have no surgery and no treatment at all. One of the main problems that I'd like to focus on today is the side effects that come with chemotherapy and radiation therapy. First, we're going to talk about chemotherapy. The side effects of chemotherapy is 1. Damage to blood cells, which can cause anemia, fatigue, and also infections. The second is damage to mucous membranes, which cause mouth sores, diarrhea, and problems with the digestive system. And the third is damage to hair root cells, which is why cancer patients oftentimes lose their body hair. The side effects I want to talk about next come with radiation therapy. Number 1 is skin changes, which can be dryness, itchiness, peeling, and even blistering on the skin. 2, fatigue, which is what causes many cancer patients to be weak and tired all the time. Other side effects that come with radiation therapy is diarrhea, hair loss in the treatment area, mouth problems, nausea and vomiting, sexual changes, swelling, trouble swallowing, and urinary and bladder changes. So, as you can see, chemotherapy and radiation therapy come with terrible side effects. The solution that I would like to propose today is to give cancer patients another option. They are given limited options, most involving chemicals and terrible side effects that they have nothing to help prevent. So, why not give them another option? We already talked about some of the options that are given, such as chemotherapy, radiation therapy, surgery, or the option to do nothing. I think a new option should be given, all-natural way to treat cancer, which will involve change in diet, aromatherapy, and Young Living essential oils. When a patient is diagnosed with cancer, I think they should sit down with a knowledgeable healthcare physician and talk about all the options that they have. Have an informational meeting where they will talk in depth about what the options they have are, so then they can make a knowledgeable decision about where they want to go with this. When it comes to dietary changes, one should eat lots of fruits and vegetables and whole grain breads and cereals, modest amounts of meat and milk products, and small amounts of fat, sugar, alcohol, and salt. One should go organic with their food and start to really watch what they're buying and what they're consuming. Dietary changes are an absolute must when a person is diagnosed with cancer. Food today is altered in many ways, and chemicals are often added, making the food more and more unhealthy. cancer patients really need to start watching what they're eating. The next is aromatherapy, which will involve smelling of the oils and oftentimes massages. Aromatherapy is used to alter mood or improve health. It does not necessarily prevent or cure cancer, but can also help to enhance the quality of one's life. Scent receptors in the nose send chemical messages through the olfactory nerve to the brain's limbic region. This helps make an emotional response, helps with respiration, heart rate, and blood pressure. Oils can be used individually, or a whole bunch of them can be used at one time. And aromatherapy has been used for thousands of years, so it's not something that was just invented. It's been used over a series of years for all different things. The oils that are used for aromatherapy are Young Living essential oils because they're 100% all natural therapeutic grade essential oils. They can be used any way, internally, topically on the skin, or aromatically by smell. They have a food label, so you can put them in your drinks, put them in your food, or just in your mouth if you wanted. Young Living essential oils come from plants, trees, seeds, shrubs, and so on. There are no additives. They're 100% pure. Young Living is known for its seed-to-seal promise. It's planted and grown directly from Young Living farms, and the farms are located all over the world. They have the best growing and harvesting methods. They distill the plants on the farms. They have a steam extracting distillery, and they work to get the best oils possible. The oils are then tested in Young Living laboratories and then sealed in amber bottles in Utah. A few oils that I would like to talk about today are peppermint, clove, peace and calming, and lemon. These are specific oils that are used for cancer. According to the American Cancer Society, peppermint is effective in helping to control nausea, cramps, and trouble breathing. It helps improve digestion, relieves intestinal ailments, eases muscle pain and tension, decreases inflammation, has a soothing effect, and reduces anxiety. Peppermint has been used and was created in Egypt and has been around for thousands of years. The next is clove, which helps relieve nausea and vomiting, improves digestion, fights intestinal parasites, helps with inflammation, helps with migraines. Clove is known as an antioxidant, and it's been in Chinese medicine since as early as 600 AD. Peace and calming is an emotional oil. It's used for pain also and helps to put yourself at peace. It helps you to sleep better, so it can be used for those that are suffering with fatigue. Lemon oil has been studied for its effect on immune function. It has antiseptic functions and is also used as an all-natural antidepressant. Gary Young, the owner of Young Living Farms, once said that the oils don't heal you, the oils help your body to heal itself. The oils aren't a cure-all. They aren't magical or capable of fixing you instantly. They're just a completely all-natural medicine that you can use to help your body to help itself. For someone diagnosed with cancer, options are very limited, and that's because they are. But even if the oils don't cure someone's cancer, what if the oils can help manage the pain and side effects that come from treatment such as chemotherapy and radiation therapy? So in conclusion, I'm not saying that I'm a doctor, and I'm not saying that these oils will cure someone. But I do believe that cancer patients should have another option, and essential oils, aromatherapy, eating differently, and an all-natural option should be one of them. Thank you.